Brain tumors. The brain is protected by the bony skull. Therefore brain tumors have little room to expand without pressing on other parts of the brain. The brain consists of right and left cerebral hemispheres. Each hemisphere consists of an outer layer of gray matter, the cerebral cortex. These cells almost never form tumors. 2. A core of white matter composed of nerve fibres, which connect the neurons to the rest of the body. 3. Support cells for the neurons, a common source of brain tumors. They include oligodendrocytes, which produces insulating myelin sheaths for nerve fibers, and astrocytes, which nourish the neurons and may help store information. The brain is covered by membranes, the meninges, from which benign tumors called meningomas may arise. Other possible sites are the cerebellum, which controls balance, and the brain stem, which regulates respiration and the heartbeat. Types of brain tumors. A brain tumor, known as an intracranial tumor, is an abnormal mass of tissue. In the brain, tumor cells grow and multiply uncontrollably, seemingly unchecked by the mechanisms that control normal cells. More than 150 different brain tumors have been documented, but the two main groups of brain tumors are termed primary and metastatic. Primary brain tumors include tumors that originate from the tissues of the brain or the brain's immediate surroundings. Primary tumors are categorized as glial, composed of glial cells, or non-glial. Non-glial tumors are developed on or in the structures of the brain, including nerves, blood vessels and glands. They may be either benign or malignant. Metastatic brain tumors include tumors that arise elsewhere in the body, such as the breast or lungs. They migrate to the brain, usually through the bloodstream. Metastatic tumors are considered cancer and are malignant. Metastatic tumors to the brain affect nearly 1 in 4 patients with cancer. Up to 40% of people with lung cancer will develop metastatic brain tumors. In the past, the outcome for patients diagnosed with these tumors was very poor, with typical survival rates of just several weeks. More sophisticated diagnostic tools, in addition to innovative surgical and radiation approaches, have helped survival rates expand up to years. They are also allowed for an improved quality of life for patients following diagnosis. Types of benign brain tumors. Chordomas are benign, slow-growing tumors that are most prevalent in people ages 50 to 60. Their most common locations are the base of the skull and the lower portion of the spine. Benign tumors. Although these tumors are benign, they may invade the adjacent bone and put pressure on nearby neural tissue. These are rare tumors, contributing to only 0.2% of all primary brain tumors. Craniopharyngiomas typically are benign, but are difficult tumors to remove because of their location near critical structures deep in the brain. They usually arise from a portion of the pituitary gland, the structure that regulates many hormones in the body. Therefore, nearly all patients will require some hormone replacement therapy. Gangliocytomas, gangliomas and anaplastic gangliomas are rare tumors. They include neoplastic nerve cells that are relatively well differentiated, occurring primarily in young adults. Glomus jugulare tumors most frequently are benign and typically are located just under the skull base, at the top of the jugular vein. They are the most common form of glomus tumor. However, glomus tumors, in general, contribute to only 0.6% of neoplasms of the head and neck. Meningiomas are the most common benign intracranial tumors, comprising 10 to 15% of all brain neoplasms, although a very small percentage is malignant. These tumors originate from the meninges, the membrane-like structures that surround the brain and spinal cord. Pineocytomas are generally benign lesions that arise from the pineal cells, occurring predominantly in adults. They are most often well-defined, non-invasive, homogeneous and slow-growing. Pituitary adenomas are the most common intracranial tumors after gliomas, meningiomas and schwannomas. The large majority of pituitary adenomas are benign and fairly slow-growing. Even malignant pituitary tumors rarely spread to other parts of the body. Adenomas are by far the most common disease affecting the pituitary. They commonly affect people in their 30s or 40s, although they are diagnosed in children, as well. Most of these tumors can be treated successfully. Schwannomas are common benign brain tumors in adults. They arise along nerves, comprised of cells that normally provide the electrical insulation for the nerve cells. Schwannomas often displace the remainder of the normal nerve instead of invading it. Acoustic neuromas are the most common schwannoma, arising from the 8th cranial nerve, or vestibular cochlear nerve, which travels from the brain to the ear. Although these tumors are benign, they can cause serious complications and even death if they grow and exert pressure on nerves and eventually on the brain. Other locations include the spine and, more rarely, along nerves that go to the limbs. Types of malignant brain tumors. Gliomas are the most prevalent type of adult brain tumor, accounting for 78% of malignant brain tumors. They arise from the supporting cells of the brain, called the glia. These cells are subdivided into astrocytes, ependymal cells and oligodendroglial cells, or oligos. Glial tumors. Glial tumors include the following. Astrocytomas are the most common glioma, accounting for about half of all primary brain and spinal cord tumors. Astrocytomas develop from star-shaped glial cells called astrocytes, part of the supportive tissue of the brain. They may occur in many parts of the brain, but most commonly in the cerebrum. People of all ages can develop astrocytomas, but they are more prevalent in adults, particularly middle-aged men. Astrocytomas in the base of the brain are more prevalent in children or younger people and account for the majority of children's brain tumors. In children, most of these tumors are considered low-grade, while in adults, most are high-grade. Ependymomas are derived from a neoplastic transformation of the ependymal cells lining the ventricular system and account for 2 to 3% of all brain tumors. Most are well-defined, but some are not. Glioblastoma multiforme, GBM, is the most invasive type of glial tumor. These tumors tend to grow rapidly, spread to other tissue and have a poor prognosis. They may be composed of several different kinds of cells, such as astrocytes and oligodendrocytes. GBM is more common in people ages 50 to 70 and are more prevalent in men than women. Medulloblastomas usually arise in the cerebellum, most frequently in children. They are high-grade tumors, but they are usually responsive to radiation and chemotherapy. Oligodendrogliomas are derived from the cells that make myelin, which is the insulation for the wiring of the brain. Other types of brain tumors. Hemangioblastomas are slow-growing tumors, commonly located in the cerebellum. They originate from blood vessels, can be large in size and often are accompanied by a cyst. These tumors are most common in people ages 40 to 60 and are more prevalent in men than women. Rhabdoid tumors are rare, highly aggressive tumors that tend to spread throughout the central nervous system. They often appear in multiple sites in the body, especially in the kidneys. They are more prevalent in young children, but also can occur in adults. Pediatric brain tumors. Brain tumors in children typically come from different tissues than those affecting adults. Treatments that are fairly well tolerated by the adult brain, such as radiation therapy, may prevent normal development of a child's brain, especially in children younger than age 5. According to the Pediatric Brain Tumor Foundation, approximately 4,200 children are diagnosed with a brain tumor in the U.S. 72% of children diagnosed with a brain tumor are younger than age 15. Most of these brain tumors grow in the posterior fossa, or back, of the brain. Children often present with hydrocephalus, fluid buildup in the brain, or the face or body not working properly. In children, some types of brain tumors are more common in children than in adults. The most common types of pediatric tumors are medulloblastomas, low-grade astrocytomas, pilocytic, ependymomas, craniopharyngiomas and brainstem gliomas. The World Health Organization, WHO, has developed a grading system to indicate a tumor's malignancy or benignity based on its histological features under a microscope. Most malignant, rapid growth, aggressive, widely infiltrative, rapid recurrence, necrosis-prone. Symptoms of brain tumor. The signs and symptoms of a brain tumor vary greatly and depend on the brain tumor size, location and rate of growth. General signs and symptoms caused by brain tumors may include new onset or change in pattern of headaches, headaches that gradually become more frequent and more severe, unexplained nausea or vomiting, Vision problems, such as blurred vision, double vision or loss of peripheral vision. Gradual loss of sensation or movement in an arm or a leg. Difficulty with balance. Speech difficulties. Feeling very tired. Confusion in everyday matters. Difficulty making decisions. Inability to follow simple commands. Personality or behavior changes. Seizures, especially in someone who doesn't have a history of seizures. Hearing problems. Causes for brain tumor. Brain tumors that begin in the brain. Acoustic neuroma. Acoustic neuroma, schwannoma, child with a medulloblastoma brain tumor. Medulloblastoma. Primary brain tumors originate in the brain itself or in tissues close to it, such as in the brain covering membranes, meninges, cranial nerves, pituitary gland or pineal gland. Primary brain tumors begin when normal cells develop changes, mutations, in their DNA. A cell's DNA contains the instructions that tell a cell what to do. The mutations tell the cells to grow and divide rapidly and to continue living when healthy cells would die. The result is a mass of abnormal cells, which forms a tumor. Primary, secondary. In adults, primary brain tumors are much less common than are secondary brain tumors, in which cancer begins elsewhere and spreads to the brain. Many different types of primary brain tumors exist. Each gets its name from the type of cells involved. Examples include gliomas. These tumors begin in the brain or spinal cord and include astrocytomas, ependymomas, glioblastomas, oligoastrocytomas and oligodendrogliomas. Meningiomas. A meningioma is a tumor that arises from the membranes that surround your brain and spinal cord, meninges. Most meningiomas are non-cancerous. Acoustic neuromas, schwannomas. These are benign tumors that develop on the nerves that control balance and hearing leading from your inner ear to your brain. Pituitary adenomas. These are tumors that develop in the pituitary gland at the base of the brain. These tumors can affect the pituitary hormones with effects throughout the body. Medulloblastomas. These cancerous brain tumors are most common in children, though they can occur at any age. A medulloblastoma starts in the lower back part of the brain and tends to spread through the spinal fluid. Germ cell tumors. Germ cell tumors may develop during childhood where the testicles or ovaries will form. But sometimes germ cell tumors affect other parts of the body, such as the brain. Craniopharyngiomas. These rare tumors start near the brain's pituitary gland, which secretes hormones that control many body functions. As the craniopharyngioma slowly grows, it can affect the pituitary gland and other structures near the brain. Cancer that begins elsewhere and spreads to the brain. Secondary, metastatic, brain tumors are tumors that result from cancer that starts elsewhere in your body and then spreads, metastasizes, to your brain. Secondary brain tumors most often occur in people who have a history of cancer. Rarely, a metastatic brain tumor may be the first sign of cancer that began elsewhere in your body. In adults, secondary brain tumors are far more common than are primary brain tumors. Any cancer can spread to the brain, but common types include breast cancer, colon cancer, kidney cancer, lung cancer, melanoma. Risk factors for brain tumor. In most people with primary brain tumors, the cause of the tumor isn't clear. But doctors have identified some factors that may increase your risk of a brain tumor. Risk factors include exposure to radiation. People who have been exposed to a type of radiation called ionizing radiation have an increased risk of brain tumor. Examples of ionizing radiation include radiation therapy used to treat cancer and radiation exposure caused by atomic bombs. Family history of brain tumors. A small portion of brain tumors occurs in people with a family history of brain tumors. Otherwise, a family history of genetic syndromes may increase the risk of brain tumors. How is a brain tumor diagnosed? Doctors use several tests to confirm the presence of a brain tumor. These tests include physical exam and medical history. Your doctor will perform a general health exam, looking for signs of diseases or illnesses. Your doctor will also ask questions about past and current health conditions, surgeries and medical treatments and family history of disease. Biopsy. Through a small hole in the skull, a doctor uses a needle to take a sample of tissue from the tumor. A laboratory studies the sample to identify details from the tumor, including how fast it is growing and whether it is spreading. Imaging tests, CTs, MRIs, SPECT and PET scans help doctors locate the tumor and determine if it is cancerous or benign. Your doctor may also look at other parts of the body, such as the lungs, colon or breasts, to identify where the tumor started. Neurological exam. During a neurological exam, your doctor will look for changes in your balance, coordination, mental status, hearing, vision and reflexes. These changes can point to the part of your brain that may be affected by a tumor. Spinal tap. A doctor uses a small needle to remove fluid from around the spine. A laboratory examines this fluid to look for cancer cells, which can indicate a malignant tumor somewhere in the central nervous system. When brain tumors are cancerous, doctors classify the tumors into 4 grades: 1, least malignant or slow growing, through 4, most malignant or fast growing, as part of the diagnosis. The grade assigned to a tumor indicates how fast it's growing and its likelihood of spreading. By grading the tumor, your doctor can determine the most effective treatment options. Management and treatment. What are the treatments for a brain tumor? Brain tumor treatment depends on the tumor's location, size and type. Doctors often use a combination of therapies to treat a tumor. Your treatment options might include surgery. When possible, surgeons remove the tumor. They work very carefully, sometimes doing surgery when you are awake, to minimize damage to functional areas of the brain. Radiation therapy. High doses of X-rays destroy brain tumor cells or shrink the tumor. Some people have radiation before surgery to shrink a brain tumor so that the surgeon can remove less tissue. Chemotherapy. Anti-cancer drugs kill cancer cells in the brain and throughout the body. You might receive chemotherapy through an injection into a vein or take as a pill. In some cases, doctors use chemotherapy before surgery to make the tumor smaller. Your doctor may recommend chemotherapy after surgery to kill any cancer cells left behind or to prevent remaining tumor cells from growing. Immunotherapy. Immunotherapy, also called biological therapy, is a type of treatment that uses your body's own immune system to fight cancer. The therapy mainly consists of stimulating the immune system to help it do its job more effectively. Targeted therapy. Drugs target specific features in cancer cells without harming healthy cells. Your doctor may recommend targeted therapy if you have trouble tolerating the side effects of chemotherapy, such as fatigue and nausea. Laser thermal ablation. This treatment uses lasers to heat and destroy tumor cells. Watchful waiting/active surveillance. A doctor closely monitors the tumor for signs of growth with regular testing, but does not take any other action. How can you prevent a brain tumor? You cannot prevent a brain tumor. You can reduce your risk of developing a brain tumor by avoiding environmental hazards such as smoking and excessive exposure to radiation.